All right, normally, good morning. I wouldn't normally use a microphone for this size of a crowd, but we didn't know how many to expect, and we're streaming, so I have to get the voice in there somewhere. We'll give folks just a few more seconds to wander in. We've got a few more folks coming in here. So, was anybody at the last GRPS meeting? Was it? Can you tell me how many folks were at it? Okay. Okay. Okay, so maybe we should wait just a minute, because how is parking out there? I don't know if everybody's able to, yeah. Yes. We are. We are. Why would I tell you no? We believe in streaming. It's elemental to democracy, I think. All right. You know what? We'll go ahead and kick off. My name is Steve Kelso. I'm the communications manager here at the Kent County Health Department. Today you're going to hear from Joost Van Turf. He's the toxicologist for the Michigan Department of Health and Human Services, and our Dr. Nurali Borum. Back in February, when we became aware of this, we went to the MDHHS and asked them to conduct this study on your behalf, and most of that has been complete at this point, and so Joost is going to bring you up to date on that. When we get to question and answer, I am going to ask everyone else to come and suffer the same thing that I've had to do. You're going to have to talk in the microphone and address your questions there, even though. Joost.
Is there a way we can bring that one over there? Because everyone's sort of over there. So from over here.
Which?
It'll work, I guess. Good morning, everyone. Way over there. So today I'm going to tell you about the North Park Montessori Health Consultation that we did. As Steve said, to see what the public health impact of the construction activities that happened at GFS North Park Montessori were. So what we're going to talk about today is sort of what is a health consultation. I imagine many of you have not heard what this is before, what the data was that we used, what the conclusions were, the process of how we evaluated all the data that we have and how we got to the conclusions that we're making. There were questions about reconstruction of exposure by drilling new holes into the wall. And then what are the recommendations that we're making based on all the data that we have. So to give you an idea of what a health consultation is, so it really is a report with the information that responds to a very specific health question. Is that better? I will. I can do that. Is that better? Okay, never mind. So a health consultation really is a report with the information that responds to a very specific question or a possible environmental problem. So it's not a health study, it's not a medical evaluation of the things that we see. It really is a report for a very specific health question. So for North Park Montessori specifically, MDHHS assesses the potential health problems from... Okay, no problem.
Thank you.
The funds of the morning meeting, right? So we assess the potential health problems for the contact with the construction dust itself. The health consultation of the building, so we had the classrooms here on the top right, and there was that had no detection. In the cafeteria, there was no detection of asbestos, and there was a detected of asbestos in the main entrance again and in the gymnasium. So there's good correlation between where the asbestos was found in the air and where it was found in the dust. Of course. Go ahead.
So you had to use what you were given.
Yes.
Would you guys consider this, and to me it was like a pretty thorough assessment, or would you guys have required a lot more samples, kind of, you know what I mean? Kind of
Yes.
more that day?
Right. So I mean, there are gaps in where they sampled and where they did not. I think the big problem, and I hope I'm getting into it later, is what the level really represents. So you can detect the asbestos fibers, but like I said, most of it is blown out of the room.
So is the level that we're seeing, is that really the maximum amount that was in the room itself? So it's more of a qualitative way to look at it, so yes, no detection versus there is that much, but it could have been more. Does that help? So what were the levels detected? So the asbestos in the air, there were 2 samples out of the 27 that I just showed you that had detected asbestos levels. So they were very low, and you've heard before about this AHERA clearance level. So that's 0.22 fibers per cubic centimeter in this specific case. And all these 2 samples that were detected were below that screening level. Now the asbestos in the dust, there's detection in 2 out of the 4 dust type samples. So we had 1 at around 500 structures and 1 at around 10,000 structures per centimeter square. Now again, there's no regulatory level of how much asbestos they're supposed to or allowed to be in the dust, but we, using EPA guidance, we consider that anything over the 5,000 structures would be greater than what you consider as a background. So that would tell us that yes, there was release of the asbestos from the walls into the dust, and that dust people could have come into contact with at an elevated level. Then the next question, so what about the lead and silica? Well, unfortunately, we have even less data about these 2 chemicals. So there was lead-based paint found in 2 out of 11 paint chip samples. So again, that would sort of represent paint on the wall as it is. So it's not paint in a disturbed state, so we have no data of the paint in the dust or in the air, or lead, at least in the paintings here. There was also quartz that was found in nearly all of the plaster, and that's the source of the silica. But again, we have no idea how much of that silica was in the air or in the dust because we have no measurements of it. But it's likely that at least some of it was there and people could have been exposed to it. So then the next part of this, so now we know that there has been, or there's likely has been an exposure. So what are the risks to the health from that exposure? So you've heard before that the health effects potentially from asbestos. So if we breathe in an occupational setting asbestos fibers for a very long time at a very high dose, we can develop cancer or mesothelioma in the case of asbestos as well. And then swallowing lead-containing dust can result in decreases of academic achievement, attention-related behaviors, and those mental health problems. So how do we put this into context, the data that we have? So if you look here at the very top, the top left, there's the higher risk group. So we have high dose of asbestos fibers in the air, around 10,000 fibers per cubic centimeter. So this is what you find around a typical asbestos mine. Very, very, very high. Worker exposure, so people working with asbestos insulation, those type of materials are lower again. And here you see where the AHERA school clearance level is, as well as the levels detected at North Park Montessori. So they're again below that clearance level, but like I said before, we don't exactly know how much more there could have been. There could have been more because of the way that the sampling was done. So it's possible that some of these samples could have been above this AHERA clearance level or even below. We still think that is generally a low risk, and I'll tell you why. So the literature says that breathing asbestos, even for a high dose of asbestos, even for a short period of time, is not still has a very low risk compared to miners and workers, because what they do is on the second figure is you breathe high levels for a very long period of time. So even if, because the construction window was so short, the 3-month period, even if the levels at some point during that course were higher, in the overall scheme of things, it was a very short exposure. So the health risks associated with that are very low, compared to the miner who sees those levels all the time for a very long period of time, years and years and years. The other good thing about the characteristics of the dust is that the fibers that were detected were all considered very small. And there's evidence in the literature that the smaller the fibers are, the less harmful they are for causing cancer. So all the fibers that were detected were the smaller variety. So putting all of this together, we have a relatively short period of time in the case of asbestos health effects that would be a low risk. We have a relatively low amount of detected fibers, again a low risk, And then the type of fibers that we found, the short fibers, again, poses a low risk to health. So that's why we think, even though the exposure likely occurred, the health risks from it are probably not likely to happen. But we cannot rule them out because this exposure has occurred. So the question was asked in the last meeting that we attended is, how can you recreate the conditions? Can you cut into the wall again? Get a better answer a better answer, because we have some serious uncertainty. So we don't recommend making the new cuts in the wall to get a better estimate of what people would be doing or what people could have been exposed to in the past. It would again be an estimate of an estimate, more uncertainty. So the levels that we have would have given the most realistic estimate of the levels that would have been in the school when it was in an undisturbed state. There's another problem, is that cutting into the wall now, so we considered not making new cuts, but what if the construction, because there is going to be new construction at the school, what about doing sampling while the construction is happening? That would be a way around it. Unfortunately, MIOSHA told us that cutting into the plaster now the same way as it was done before was going to be illegal. So they would have to change their practices to now follow all the asbestos safety laws. So it would mean if we place a sampler there the next time, the conditions were very different from what you saw in the 3 months construction that happened before. So we could do the measurement, but it wouldn't be representative of anything that people saw in the school before. So that all leads us to the results that we have here. So the most important part of this is that even if we could do all of these things, the recommendations that Dr. Bohr is going to make to you in a minute would not change. The data that we have is really enough to sort of make good recommendations as to how to protect your long-term health from this exposure. So in summary, it's likely that the construction activities caused asbestos-laden silica to be released in the school during that 3-month construction period, and people could have come into contact with at least some of the dust. We don't think that there is going to be any future health problems from this. They're not likely, but we cannot rule them out because we have this uncertainty. And then any recreations of the effect that we can do are not really going to change any of the recommendations that we're going to make to you in a minute. So now I'll hand it over to Dr. Bohr.
So first, I want to just thank all of you. Can you hear me okay? Okay. So I want to thank you all for your patience. So I do recognize that it's taken us a long time to reconnect with you and kind of share what we found. And I feel like I'm really far away. I'm going to just...
I can do that. Push the button.
Can you do that for me? Okay. Okay, now I can actually see you. So as a parent, I really understand your concerns for the health of your children. As a doctor, I want to give you clear answers about what we do next and what we can do to make things better. But as you all know, this is really just not a black and white situation. And I also recognize that uncertainty, especially when it comes to the health of your children, is incredibly stressful, and that stress in itself can have negative consequences. And so what Dr. Venturov spoke to you about was these exposures, and while I feel that these findings of having a low-risk exposure is reassuring, I know that we can't predict the future. And as we learn about more toxins in the air and the food and everything out there, this uncertainty is going to remain. So I do want to share with you a few things that we could do and things that many of you have already been doing for your children. So I know this sounds trite, and especially in this situation, you've heard this a million times, to live a healthy lifestyle, but I'm a family doctor. I really have to go back to this a little bit, just because we know it's so true. A study came out just last year showing that people have a life expectancy at the age of 50 years. That's 14 years longer for women and 12 years longer for men, for people who follow 5 basic principles. And these were people who didn't smoke, had a healthy weight, exercised 30 minutes every day, had moderate alcohol use, and had a healthy diet. So I know it's not what you want to hear right now, but it is one of the things that we can do. As we get exposed to more and more environmental toxins, as we learn more about environmental toxins out there, this is something that we have in our power to control. So modeling these behaviors for your children, encouraging them in your children is going to be one way, just protecting yourself and your family. So when it comes to your children, so you've heard this before, I know that too, but there's really no testing or imaging that can be done right now or in the near future to really understand what exposure there has been or any potential future risks. That doesn't mean 20 or 40 years from now there will be new technology that says, maybe we can detect things that previously we couldn't. Who knows what's going to happen then? So for that reason, I do recommend talking to your doctors and thinking about it. Not everyone needs it in their medical history, but it may be worthwhile considering. If I had a patient come to me in a similar situation, I would personally probably want to add it to their medical history, just so it's something that I can follow up on and make sure to, as a person moves on to perhaps a new doctor or a new town, that's something that stays in their chart that somebody can think about 20 years down the road. Signs of stress in children. So this is something you've probably already been thinking about for a long time, but children can manifest stress in different ways than adults. So they may feel anxious, they may feel guilty. You might see changes in sleep patterns, difficulty concentrating. If your child shows these signs, what are some things that you can do? So one thing would be, reassuring your children that you're doing what's healthy for them. You have a healthy lifestyle, they're in a safe home, they're in a safe school right now. Another thing is that children can often blame themselves for things that are even not in their control. So reminding them that this is really not their fault. Some children, will never experience signs of stress from a situation like this. Some children will heal, and some children will heal quickly. Some children may need more help in that whole process. If you feel like your child needs a little bit more help in that process, I'd recommend talking to your child's doctor. If people need more mental health counseling, on the back of your insurance card, there's information on how to access mental health providers that would be covered by your insurance. And Network 180 is also another option. So for adults who in the school who may have been exposed, for them, I would feel a bit more strongly about talking to your primary care provider. People who have a smoking history or may have a chronic lung issue and may have had exposure, it might be different for them on how, what testing or imaging would be recommended at this time. And that's something that someone's doctor could help them really understand if there's anything that could be done right now or should be done right now. Signs of stress in adults. You're probably familiar with some of these, but changes in energy level, fatigue, changes in sleep, changes in eating habits, use of substances to help cope with emotions. These are all signs that maybe things aren't as okay as they may be. And if this is something that you or your friend or your neighbor or family is experiencing, I would suggest, again, talking to your doctor. You could also, again, seek further help from mental health counseling, because this is an important issue as whenever we deal with something that's out of our control or just uncertain. And so, when we talk to your doctor, a lot of doctors are really not familiar with asbestos and what that really means. I've had to do a lot of learning as well. So we put together a letter for physicians that will be available on our website that will have a copy. Do you have a copy as well? Yeah. So it goes over really briefly kind of what the MDHHS health consultation has. Also talks about including this exposure on their health history if they feel like that would be needed. Provides links to some other education. So there are case studies on asbestos. The health consultation will be there soon. The ATSD or fact sheet will be there too. And so if you go to them and they really don't know what you're asking, this is something you can refer them to. You can bring it to your doctor as well, and they can always call us. We're happy to talk to them. I can talk to them from what I know. I can refer them to MDHHS as well, who's toxicologist and epidemiologist who are more familiar with asbestos as well. Do you have any questions right now? So what we were going to do was transition to our panel. Dr. Gray will be joining us as well, and just a chance for questions, because I know it's been a long time since we've had a chance to talk with all of you. So there's mixed data on that. Some have shown that children who are exposed are less likely to have future health risks, and that's because the cilia, so what kind of moves all particles out of the lungs that are not supposed to be there, those actually work quite well in children. So it can help move things up and out more easily. So there is really not great information that I've found from children who've been exposed long term, but there have been mixed results, but overall they found that it can be lower risk in children for that ciliary reason.
One concern that many parents have, especially now seeing this map, which thank you for this, is that we recently found out that as of now in the cleanup and new construction or continued construction, there is zero plan for removing the carpet that is at the building. And when we pushed on the reasoning why, it came out because there's asbestos tile underneath. And also about there not necessarily being enough evidence or data about getting the out of the carpets. So we're wanting to hear from this panel on what your recommendation being. One, it's an elementary school. Two, it's a Montessori school. So when you add those things together, our children and our staff are always on the ground. And so things like the media center, things like a main hallway, areas like that that were tested positive. We're just feeling a little uneasy about the carpet situation.
No, you can use another one.
Yeah, I think I can. I think I'm not the expert, so what I remember from the EPA guidance that we got when we first did the consultations, there was really no way to test exactly if there is asbestos in the carpet. I think it will trap the fibers for sure.
Right, and I recall when you met with us last, when we were at City High Middle School, I believe it was beginning of March maybe when we last saw you.
Yeah.
At that presentation you said that recommendation would be for things to be just removed and replaced. And so that's where we're feeling a little uneasy. Things like rugs are being, and runners are being replaced, but yet
Right.
the carpet
Yeah.
itself isn't.
Yeah, it was the guidance that if things were able to be washed like a regular throw rug on the floor, that wash those, that would be the best way to do that. I'm not sure about carpet that's stuck to the floor. I'm not sure what the best thing to do.
We can follow up on whether there's any recommendations from the US EPA work group that we can put on the materials that will be posted on the Access Kent website. So we can ask that question again and check into, like, could carpet shampooing be something useful?
That would
or
be really
not?
helpful, because hearing from alternative sources than NOVA would be fabulous at this point.
So, couple questions. Going to this graph that you shared here with the high risk at the top and the low risk on the bottom, and that's looking specifically at the air samples. The concerning one that I'm thinking about and you referred to is the test that came back from Micro Air that showed that 10,000 parts.
Sure.
Where does that fit on this graph, and where should our concern fit on this graph?
Right, so there is no comparison for the dust itself, because really it's the air that what we breathe is how the asbestos gets into us. If it's in the dust and we don't get into contact with it, even if there's a lot in it, it's okay. What it shows really is sort of the potential for a release. So if there were a disturbance of that dust, it could get in the air, not at that 10,000 level, but because it would be very much diluted. So there really isn't a way or any type of studies to show this much asbestos in the dust is related to this risk for any health effects. So there's really no way to compare that to a concern, other than to say it's sort of above background, so maybe we should clean it up.
So does that, you mentioned a couple times that because we can't recreate, we're looking at what we're seeing now with the understanding that it could have been worse. Is that Micro Air sample a good indication that it was likely worse in the past?
No. The way the samples were collected, the methodology descriptions that we have show that there's a potential for it to be worse. I don't think any of the data really tells us that it could be worse.
And we always had the uncertainty in looking at the data that over the 3 months, we had talked last time about, because there was no daily sampling, we couldn't tell anybody exactly on day 12 versus day 23 what it looked like. So there's always the uncertainty for past exposure that we were dealing with, that it was going to be conditions at the time. We know it's 20% worse on this day, 50% worse on this day. We had no context for that past exposure. So we have the indication from this sampling only.
The second question I have, and I also want to say thanks because this whole presentation feels much more direct in answering questions that at least I've had and wanted answers to. I understand that several agencies, including MDHHS and others, had recommended more wipe sampling be done by NOVA. Would you have liked to have seen that, and would we have gotten more pragmatic information to work off of in that case?
Yeah, yes and no, because that was all based on the understanding that no aggressive air sampling would have been done in the first place. So really, by the fact that that took place, redistributed the dust around the school from the moment that it was closed. So even if we were to do wipe samples, so when we were recommending the wipe samples, we didn't understand that that's what had happened. Immediately after the school was closed, they'd done this aggressive air sampling. So in that case, it would have at least helped us to understand where the dust might have been. But since that aggressive air sampling had been done, the dust had been redistributed, so now we can't be sure where the dust went. Was it probably was more diluted, so the levels that we would have gotten wouldn't represent anything again from when people were actually in the school. And those are the numbers that we really need. So there would be greater uncertainty if we were to do it again, and that's why we didn't chose to use the NOVA samples to begin with.
So a quality air sample then, or a quality sample, was lost from the time microair was involved on that first day.
Yes.
Okay.
So a couple follow-ups then on that would be, did you look into the caulk that was used when the windows were replaced? Because I know in the results, I believe it was February 2018, it showed that there was asbestos in the caulk lining that then was used around the windows, and a lot of the windows got replaced over the holiday Christmas break, and students and staff then noticed that then they were cleaning up that caulk that was both inside the building and outdoors as well. So I don't know if you have any data on that.
No, I don't. We never evaluated that. I remember in the construction logs there was a notice of that being done by an abatement company. But other than that, I don't know.
Yeah, that's okay.
We
And
never
we've
looked
looked
at
at
that
those
part.
logs, and there's a lot of holes in them. There's a lot of great things about the weather, but not necessarily about what was happening. Okay, and then just to follow up, thank you when you were saying, what's your name again?
Jennifer Gray.
Jennifer, okay, thank you for following up about the carpet, and where some of the staff and parents are feeling is that there's such a push to get us back into that building that we are highly concerned that things are getting rushed or the timeline is getting sped up with the cleaning process and not necessarily done as thorough and accurately as possible. And obviously, we don't want this to happen again, and my fear with the carpet and hearing about the tile underneath is that could we have another, breach, if you will. And so just being sure that things are really done well and not just speed it up so we can try to appease this population and get them back in their building. So if you can just please give us any information that you would recommend of just being sure that the cleanup is done accurately and not necessarily done enough to sugarcoat us back to our building.
So
Yeah, go ahead.
sorry, let's jump in. So in terms of complying with the HERA,
Yes.
which is the regulation there, that is a program overseen by MIOSHA. And so there is a regulatory agency following that process.
Okay, good.
I don't know if exactly what steps they're taking or what they're following, but it would be the MIOSHA contact, and we can see if we can have a general number added as well for MIOSHA to follow up. Any inquiries can go there.
Okay, perfect. Thank you so much.
Because it is a regulatory process, which being a non-regulatory agency, I am sorry, I don't have the details.
That's okay.
On. And then in terms of the asbestos tile, again, the important thing to note about asbestos, if it isn't disturbed, it can be there. So the tile being under the carpet, presumably, like, nobody's going to rip up the carpet and put it back down, so it's all undamaged there.
Right, but at some point, as we all do in our homes, carpets gets replaced. Or at some point, you have the fidgety first grader who's going to peel up that carpet on their own, whether they want to or not, because they don't know how to handle their hands. So that's the concern with the population.
Yep, so when the carpet would be replaced, it would again have to comply with the HERA. So it's that regulatory process on the asbestos abatement, because there is an awareness that those tiles are there, so they would have to do that. Any type of carpet removal would then have to address that potential exposure. So whether the teachers notice a child ripping the carpet up, that would have to be addressed, just like carpet replacement would have to address that in terms of asbestos.
Okay. So you would also recommend then that GRPS is being sure our staff is trained in when to notify certain people if
I would think that would be a building maintenance issue that should be notified. I don't know, again, the policies there, but if there's an awareness that the asbestos tile is there, it would be in the asbestos management plan and HERA. And so once there's notification and awareness, it is there. And I'm sure as parents and teachers are aware of it as well for notification, that now because of the situation, there's just a greater awareness as a whole about potential issues. So that's,
Yeah.
I mean, greater awareness overall really does help making sure all the steps are taken.
yes, as well as the 12 plus citations that MDHHS has also done.
Could we have another microphone out here? Do you mind? We've got questions on both sides. It's getting a little awkward. So we're going to go to you, and then Paul, and then you, and then you. Okay.
My question is about the stuff that is in the building. There are things that they're saying can't be cleaned, but we may be able to take them home if we have, basically if we sign off and say, we're taking responsibility for this item that may have been contaminated and can't be cleaned. How do you feel about that?
So for that, I can speak with experience that we've had with other items contaminated by a different chemical in other situations. We've actually been able to measure different levels of chemicals and provide specific recommendation. For this situation with asbestos fibers, we don't have that measurement ability, so it would be the reliance on wash the item if you can. There is based on the data we have, there's a low to no asbestos fibers potentially there, and then the shorter ones. If there's any, again, based on what we know, it's likely to be low. If you do not want to have the item in your home, it is your personal choice to get rid of it. But we have no testing, and there's some items that probably can't be cleaned. So that it would be there's a potential for a low amount of contamination with asbestos fiber on that item. You can choose to wash it if you can. Wash it if you're not sure that you can, and see what happens. Sometimes things can be washed and survive. Sometimes they can't, but that's unfortunately the best information we have from the asbestos work group.
So I'm a little lacking in knowledge about HERA, and what I'm hearing from you is that is enforced by MDHHS, which typically is enforcing worker safety, correct?
They are, but this is actually a school program. It's a US EPA.
Okay.
That's the federal agency. The HERA is specifically a school asbestos regulatory program, and MDHHS does oversee enforcement of that. I've now exhausted my knowledge of the regulatory process for that, and again, that MyOSHA phone number, we can direct people to resources.
Mhm. So I guess my question is whether or not it has occupant safety standards as well as worker safety standards. And that's what I think we're most in need of at this point in time. My question, my larger question is, Dr. Bora and I and Sarah were at a talk this morning where we talked about the fact that going after the cause is better than trying to treat a cure later on downstream. And so I'm thinking forward into future work in this building and what has happened here in the past for both asbestos and for lead. We've violated a worker standard, it appears, right, allegedly. I'm wondering what the role of local public health and the state health department, and perhaps MyOSHA, since they have responsibility for Adhera, will be to ensure that, or to help us ensure that that regulatory framework, those standards are upheld going forward with the next contract, so we don't go from bad to worse.
I think your question is a good one, and one that we've been talking about too. Like, how is this? We can't find that many cases of where local public health has been involved in a situation like this. We're like, this must have happened. How can we not find more information? It sounds like this is not an infrequent occurrence. I think this happens, 5 or 10. I don't have the exact, don't quote me on the numbers, but 5 to 10 times throughout the year in Michigan. But usually local public health is never notified. So we do want to commend GRPS for at least letting us know that this happened, because they didn't have to do that. But now that we know that this is an issue, I feel like this is something that we need to be more involved in going forward. And so we would like, that is our plan, once we wrap up all of this, to really think about how can we, going forward, have more communication and connection between the different agencies who have different pieces in the asbestos world. Because if this is as frequent of an occurrence as we hear it is, then we would just like to learn more and be able to educate people and empower people to figure out what we can do. So I think it's a good question. I think we need more work on that, and something that we'd like to do as well.
Hi. First of all, thank you very much for doing the map of where everything was located and for showing where it was and was not located. That's something we haven't seen yet from either Chrisman or Micro Air or Nova Air or Grand Rapids Public Schools, so we really appreciate that, first of all. So whoever put this presentation together, I commend them, whoever you are. Thank you. And then in the beginning, you mentioned something about mental health as well. So I've noticed in my own family, and I asked my kids to step out, we've had increased anxiety in our home, like a huge jump, and we were hoping for better mental health services from Grand Rapids Public Schools, and we had actually talked with our principal about receiving some evaluations and getting some more support. And I believe we had been promised, or there was promised to us, that we would have like mental health crisis services. And I don't know, did anyone receive that, or do we know if we got that? No, a lot of people are shaking their heads no. Okay, I had to request something, and we were seen, both my kids were seen with the principal and our part-time mental health care support person for about 15 minutes, and they said within 15 minutes, this person said that they were both going to be fine, that they would adjust, and it just broke my heart because that's not how that works at all. So I'm wondering if there's any sort of services that are or recommendations that can be made to Grand Rapids Public Schools to increase accessibility and services for mental health in Grand Rapids Public Schools overall, if that's something that you do or something that you've ever done in the past to increase resources or to recommend increasing resources for mental health support.
I think it's a good point that you bring up. I don't know that's something that we've ever done, but we're willing to have that conversation to understand what's there and what are the barriers to getting better access. So.
Yeah, because something like this, it's not like it was like a huge disaster or anything like that, but it has impacted a lot of students, and it is, I mean, having our school quarantine, having all their stuff being potentially thrown away, having to move to a different place, having to be in a school in which there was a high security. They weren't allowed to like go out in the hallways. Not a lot of us had an opportunity to have contact with our teachers because the drop-off and pickup was totally different. And we noticed a lot of like lack of communication or inability to have communication with a lot of our teachers. Like their emails were overloaded and things like that, and voicemail boxes were full. So it is something that if there was something that you would be able to do, and since you've mentioned mental health, it would be a great a great thing because it's something that it's been huge in our house. And so that's my first one. So thank you very much. And then the second one is from me. The asbestos binders that are in the asbestos plan at the school that are under AHIRA don't show that there's asbestos in the tiles. That's not in the AHIRA binder. And they, I went and checked after a meeting last time. So then they mentioned that there was asbestos. Nova Air had said that, and Grand Rapids Public Schools had said that, that there was asbestos, and that's why they wouldn't recommend removing the carpet. So that's a little disturbing because if there was a carpet company that was going to go in and replace those carpets, that would not be in the binders at all. I'm noticing maybe that there's like a lack of oversight, a lack of understanding of a couple different things. So I'm wondering if you have any comment at all about, if we don't know something, how can we be sure about that? I know y'all are health folks, but if there is truly asbestos under there. And also the EPA says that, or I think it's EPA, or it might be OSHA, says that carpet is not an appropriate sealing device. Like if you put carpet down over asbestos, it does not properly contain it. It actually, because of the friction in the carpet, if it's not glued properly, it disturbs it even more rather than abating it.
So for those, again, in terms of compliance with ADHERA, we'd have to get you that contact information with MyOSHA, the contact information with the US EPA regional contacts for ADHERA, and talk through like contents. I'm sorry, I just don't have the details for that, but we can definitely make sure those contacts are in there and have them weigh in as well. Make sure to know that the questions will be coming about carpet and asbestos tile as well. And we can follow up on that.
One more about the flooring. There were cuts made into the floor. Were there any tests to determine if the asbestos in the tile was released when those cuts were made?
I guess I don't remember seeing that, but it would all fall under the same, was it found in the air, was it found in the, I'm guessing it's from the past construction.
Last fall.
Yeah.
Yeah.
So it would all sort of fall under the same, if it came from the wall plaster, if it came from the floor tiles, it would still fall under exactly what we were talking about here.
Okay, so if children were playing with the hole in the floor, we don't know, but can probably assume that they were more exposed to the asbestos in the tile, which was in the hole in the floor.
Yeah, the recommendations that we're making here, again, it's based on the levels that we have, so individual people, children, teachers could have had different exposures based on if they were closer to the dust, they were there in the school longer, in proximity to bigger sources. Yeah, there's a great degree of uncertainty in the exposure that individual people had, but I think it all still falls under the same umbrella of lower risk for future problems.
Okay, one last. Is it possible to wipe the cuts that have already been made to see what, like, somehow agitate those just to get a little bit of material off, as if a child had been poking a pen through that hole, which has happened? Can we do that?
I think you can do it, but I think it again doesn't get you a better estimate of what happens, or change the recommendations that Dr. Borum made, or get us any more certainty of what exactly happened or what the health impact is. I think we're trying to make the conservative, trying to get the best recommendations out based on everything. So.
Thank you.
First, would you be able to get MIOSHA here for a panel? Some people with more accountability. Would it be possible for you guys to pressure, get an invite, and host another panel where MIOSHA folks are here, EPA people are here, people that we can ask about? Because I appreciate all the health information. It really has put me at ease. You know, I mean, I feel like we're all being super careful, but the risk is really low. And you can't say, I feel okay, but I'm feeling that that's, you know, if I get my stuff from there and I bring it in my house, I mean, it's like really minimal risk. But you can't really talk to us about accountability. I'm wondering if there are people that could come, if you could invite them here, and we'll help you make them come. But is that something that you'd be open to or interested in helping us with?
I can't speak for them, but we can talk to them. I mean, that's the
Okay.
most we can do, and we'd be happy to talk to them.
So
see if
maybe
there's
even a
interest.
formal invitation, and then we can call and say, we know you've been invited, you're coming, right? Does that make sense? I mean, you can be really nice, you can play good cop and we'll play.
No, I mean, we're happy to have that conversation with
Okay.
them.
Can I add something to that too? Hi. The other part about that is that it is a little bit awkward for us to do that. What would be really helpful is if you folks organized the meeting and invited them and invited us, and we can encourage them to come. That might be a better order.
And just my understanding of the MIOSHA EPA interaction is that MIOSHA takes care of it for the state of Michigan. So I think MIOSHA might be more responsive than EPA, just in terms of administering the program would fall under MIOSHA.
Right.
Just some context for when you're thinking about that, because that's how some of that works. A federal agency program is administered by the state.
And then, and I think I know other people I could ask this, but since it's on my mind, are you able to tell us how many kids at North Park got tested for lead, and if any of those were elevated? Recently, I mean, because you were offering the test.
None of the levels were elevated. We had 20, I believe. I believe it was 20.
20 tested here.
And none of them were elevated.
Thank you.
The next one, I guess, is another partnership sort of question. So I noticed today that the person that is in charge of managing the asbestos binders and the asbestos management plan, a job posting was posted from Grand Rapids Public Schools for hiring a new person that is in charge of AHIRA management as well. So if this new person is hired, what sort of relationship would you, as the health department, want to have with that person? If any.
Sorry.
Thank you.
I'm the environmental health director here at the health department.
Thank
I just
you.
want to clarify,
Hi.
I'm not a random just person
Passing the
speaking
microphone.
out. You know, to be really honest, and I think Nirali and Yost and Jennifer kind of alluded to this, is that this is a bit of uncharted territory for us. We haven't been engaged or asked to engage in this way, and so I think that it's evolving. We don't really have a defined role yet at this point, but I do believe that there are conversations at the highest levels taking place about what our role is and how we're going to be involved moving forward.
So is it us that's asking you as parents? Or is it Grand Rapids Public Schools that's asking you to be involved? Or are you just doing it?
No,
because-
we were initially contacted by GRPS, and I'll let Nirali pick it up from there.
Thank you.
Oh, yeah. No, I think it's more, it's our mission to protect public health. And we want to do that. And that's what brings us joy in her work. And so I think for us, it's been also an internal questioning, like, well, how can we didn't know about this, and how can we be more involved going forward? Because we clearly think this is a public health issue. So that's where, I mean, it's more of our internal pressure, as this is our job. But of course, we would respond to parents' concern too, so.
Sorry. Yep. So you said that you took the construction logs into account as well as the test results. So I guess my question is, were the construction logs, I didn't study them, were they pretty consistent? Were there times at those beginning of those months, well before these tests, that, there might have been like a higher volume of activity, or did you feel pretty confident that, it was a consistent level and, could have been like from any time during that period?
Yeah, so really the construction logs, we used them to understand where the different cuts were made, because as you see in the map, the location of the plaster, not all the plaster contains the asbestos, so we had to be sure that the construction activities occurred in the place where there was asbestos in the wall to begin with, and it really was done throughout the building, as you probably all have seen. Right.
Pretty actively during that. Okay.
Yeah, and most of the activity or the construction that we see occurred during the night or on the holidays, and that sort of helps us understand how the exposure was. So we had to take into account exposure from the dust that sort of settled on surfaces, instead of somebody standing right next to a person cutting with a saw and breathing in that air. So it was a different level of exposure. That's how we used the construction logs.
Okay. That helps a bit. Thank you.
There's a lot of inconsistency in those logs, though. There's a
Sure.
few parents that have spent a lot of time studying them. And there's a lot of inconsistencies, because times where there's evidence of us signing in the main office as with our volunteer badges, and us seeing things happening that then were not in the logs. So that's not to say that those cuts and those things weren't still happening during loop hours or other times, as well as you saw in the logs too. There's some days where it appears as if some of the construction wasn't happening and they were just reporting the weather report to us on certain days. So it's
Sure.
not necessarily a viable piece of data.
Sorry, I have a lot of questions. So I know that in schools, in Grand Rapids schools and other districts as well, there's been other issues with our schools being healthy, so to speak, issues with mold or other kinds of dust. Are there regular things that the health department is involved with that tracks that sort of issues? Sarah.
So in the olden days, the local health department used to do regular inspections of schools, and they would inspect them and do the audits that you're talking about. I don't know what the time frame was, but that was then moved out of the role of the local health department and moved to, I believe, MIOSHA or Department of Licensing and Regulatory Affairs. So our engagement with schools is largely complaint-based and or food service related. So looking at your kitchens and what the food that's being served to your children is.
Okay, so for example, we had a cut made into our cafeteria that was through the floor, and you could like see above it, and kids were like looking through the floor into the cafeteria, right? This is the thing that happened, right? Okay, so let's say, for example, that this then affects our cafeteria. Would we have to, you said it's complaint-based that your interaction with, like let's say that someone was working there and said, hey, the construction team cut and did this. Would there be any interaction between you and our school to investigate that complaint?
We would engage in the process. We would likely work with our state partners on that, like MIOSHA or Department of Labor and Regulatory Affairs. But we wouldn't be acting alone, I guess is the best way to say it. We'd likely be working with Eagle too, with their indoor air if needed, if they were concerned about asbestos or something airborne.
Because asbestos can be ingested as well, correct? And cause damages in the intestinal lining?
I defer to Yost.
Yeah, it's possible again, but the reason we don't, the risk of of health problems from the ingestion is even lower than breathing them in through the air. So that's why we focused mostly on the air, because that's the route of greatest concern. There is not a not concern about ingesting asbestos, but it's much lower than the air.
And then my last question, thank you so much for indulging me. I know you get a lot of questions you can't answer, and it's because maybe we're looking for somewhere to put our questions or someone to take them. So then the last one is about the dust itself, or not the dust, but the collected, I guess it's considered dust, the dust you can see on the surfaces. So in some classrooms, and my own children cleaned up dust, which means that they were using cloths or feather dusters or whatever is in their classroom to remove it from surfaces. And it's something that our kids do, part of practical life, learning to become adults and do things like that. So this is something that my own kids did, which would have made it airborne, so to speak. So is there any, and I don't know if you mentioned this before, is there anything that we should be concerned about when we're thinking about our children's health and thinking about the future, if we're noticing things, respiratory issues? Is it possible, since we don't have conclusive evidence about how it manifests in children, that it may be causing other sorts of issues other than asbestosis or mesothelioma, that just maybe like other sorts of things? Like my kids have had pneumonia. They've had 4 cases of pneumonia since we started school. We get a lot of coughs, a lot of breathing issues. Is there anything that we should be thinking about other than like these major forms of like mesothelioma or things like that could have been caused by the dust in our classroom?
So the dust certainly, so the asbestos part of it wouldn't cause any cough or any symptoms right now. That's not really how it works, but the dust can. I mean, people are allergic to dust. Some people have dust allergies. Some people have allergies to dust mites. The particles can be irritants for people who have asthma. Pneumonia, I'm not quite so sure how that would connect, but I think if there's an asthma exacerbation from dust, it could happen with any kind of dust. So I do think there's a connection, like there's a potential connection would definitely be there.
Yeah, because I mean, like if even if the dust had no asbestos in it whatsoever, our kids have been dealing with a lot of construction dust because there was no tenting or anything done to contain any of the construction whatsoever. So it is an increased amount of whatever particles in the school. Our air quality had been really bad. So I appreciate that very much. And we've done allergy testing and things like that to see if it was caused by
But even just the particulates, you're right. I mean, even just those particulates can be definitely irritating.
Okay. So, and there's also children that have asthma in our school and things like that have a greater risk of irritants and things like that.
Yeah, certainly.
Yeah, thank you.
So thinking about, you feel like the exposure was relatively low, and while you can't completely rule it out, you feel like any thing coming out of that is a low risk. I assume that you're saying that to parents for the biggest part, talking about children, thinking about the teachers who are in there maybe almost twice the amount of time. Would you say that there's any difference in risk there?
The only reason that I say that there may be is because we know that smoking and asbestos together, exposure together, are worse risk than in each one alone. And if there have been prior exposures that no one knows of, they've been teacher for 25 years, and there could have been exposure 15 years ago that just went unnoticed. I think that's why I do think there could be that's why I feel a bit more strongly that a teacher who's been teaching there for a long time or has any underlying lung issue should consider talking to their doctors about it. So.
And then when you were talking about microaires testing, you're talking about those initial results that were on February 21st? The ones that we got, like, I think 6 different.
Yeah, the samples were taken the 15th, 16th, and 17th. I think the report date might be determined.
Okay. And you're saying that those are the ones that were done aggressively, but they were not controlled?
Correct.
And you're saying that based on your evaluation of their procedures?
Yeah, so we talked to Micro Air, and there in the health consultation there's going to be 2 letters attached to it that explain from Micro Air what they did. And so we asked a question, was the room contained, and they answered no.
Okay. I'm asking because NOVA has also kind of pointed at that as being a problematic factor, and I didn't know if your assessment of their procedures was independent of NOVA or because of NOVA.
No, we had that was our interpretation
Your
that we
own.
had from ourselves together with the US EPA's technical work group, and because initially we thought that the samples wouldn't be useful at all, but they told us at least it would represent sort of a more typical way that they were done, so we could at least do some type of health-based interpretation of these samples.
And I know this is hypothetical and you may not be able to answer it, but going back to that, again, that one graph of high risk,
Sure.
commensurate to people doing, work on that all the time. And you're saying that North Park is down here somewhere. If we were hypothetically to take that higher number of 10,000 parts and extrapolate that based on the days of school from the first cut in November to the last cut in February, would your concern be greater for the health of kids?
No, that's exact. So that's sort of the assumption that we make using the values that we have. So for these all these days, we calculated. You'll see it in the health consultation. We calculated what the cancer risk factor would be based on the information that we have from the literature, and it was still below acceptable levels.
Okay, thanks.
You're
Appreciate
welcome.
One other question. Say we want to really stay on top of this. We get this document in their file. In 20 years, would an X-ray be the right tool for assessment? If you want, or do people wait until they have symptoms? What can help us in the future?
That's a tough one. I don't know what the technology is going to be in 20 years. They may think, X-rays may be totally outdated by then. At this point, if someone had, I think it probably would be somewhat symptom-based. Symptoms tend to come, it's a hard question for me to answer right now, because an X-ray may show that it's not going to show plaques. I guess if a teacher would present right now, if I saw a teacher who'd been smoking for a long time and had asbestos exposure, I would consider maybe a lung CT or something like that. But I think it would. It's hard for me to say, because I think if someone had this exposure 20 years ago and it was a potential and low risk, I'm not sure I'd even want to expose them to imaging unless they had symptoms of something that were worrisome. If there was I think based on that, then I would make a decision, because even one X-ray at this point is going to be more radiation exposure that is really unnecessary. So, sorry, I don't have a good answer right now.
Thank you.
Any other questions? Yes.
Last one. Would you recommend or make a recommendation that schools do not have active construction during school years if children are present due to potential risk? If there's asbestos present in a school? Known asbestos?
I mean, I don't feel like I'm an expert to make any of these recommendations. I think they should be following OHRA standards. Like, if there's known asbestos, then that construction should not be happening when children, without the proper, restrictions and protection and everything to ensure that everyone who's in the area is safe.
Thank you. I would add is, that's really the bailiwick of MIOSHA, and as long as they are compliant with the OHRA regulations and what they're doing, it would really fall under MIOSHA to make that determination. Thank you.
Is there anyone else? Well, folks, I guess I thank you for coming at this point. If you have any other questions, if you want to hang around for a bit, please feel free to. But I guess I'd say have a nice day. Thanks for coming.
Thank you for coming.